This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So I'm just going to say a quick hello. I'm Casey Smith. I'm the newly named program director here at the University of Kansas. I've been here at KU since 2014, where I've been the fellowship director for our NAS accredited spine fellowship. I recently was named residency coordinator, following the footsteps of some great predecessors. I feel really proud of our program. Dr. Yoon and Dr. Hyatt will talk a little bit more about it, but in my time that I've seen since I started in 2014, we've gone from no NIH funding in our department to, I believe we're definitely top 15, I think top 10 in the country in NIH funding. We've established a research track within our residency program, and according to the U.S. News and World Report, we were in the top 25 for residency programs. So there's been a lot of growth. We've got fellowships in both NAS accredited spine program. We have an association. One of our residents is doing the ACGME pain fellowship. Dr. Yoon recently matched in our NAS program for next year, so very exciting. And we also have cancer fellowship opportunities. So I feel very proud to be here at KU, and I'll let Dr. Yoon and Dr. Hyatt kind of give you a little bit more information about the program. And I'm not sure if anybody has any questions for me too, I'm also happy to help, but they're probably better question answers than I am.
Perfect. Thanks, Dr. Smith.
All right, thanks.
Hey, everybody. My name is Andy Hyatt. I am a fourth year chief resident here at KU along with Victor. I grew up in Kansas City, so I'd be happy to answer some city/town related questions when we get to that. But I just want to thank you guys for being here. I know it's kind of a lot getting all these presentations at once, so we'll try and highlight some of the things that make our program unique, because the truth is there's a lot that's very similar amongst all of these. So we appreciate you guys being here, and happy to answer any questions you have. I'll let Victor kind of take it away and explain a little bit more about our program.
Okay, thank you, Andy. So I'm Victor Yoon, PGY4. I'm the academic chief, along with Andy, who is our admin chief. So we work together in chief roles. And I'll be giving you a relatively brief presentation because I know we have a limited time, and many of you have been sitting here listening to all these talks for several hours already. So I'm going to make the presentation and the slides as short as possible. I've really condensed it to just the cores that hits the strengths of our program, and then open it up to questions and just kind of make it a little more casual. So that way, if you have any general questions or any fun questions, whatever you have, you can ask, and it can be a little more. Let's get going. All right, just a brief overview what it looks like over here at University of Kansas Medical Center. We are in the heart of Kansas City, and this is basically the entirety of the medical campus town area. There are a lot of satellite campuses.
Hey, Victor, your mic is cutting out a little bit.
Okay, can everybody hear me okay? Andy, let me know if the sound ever cuts off. I'll try to switch to a different mic if that happens.
Yeah, it's just kind of bouncing in and out. I'm not sure what's going on. Like, I can hear you now, but I'm just letting you know.
Give me a second then. All right, so different mic. Let's try this instead. Okay, and hold on a second. This is on the timer. I'm sorry about that. Yeah, so you just heard from Dr. Smith. Okay, give me just a second. I'm sorry about this.
Sorry, guys, technical difficulties. While Victor's kind of messing with that, I'll just say a couple of quick things. He's going to get to the call schedule in a little bit, which I think is one of the maybe highlights of our program. I think one other thing that's really nice about the faculty is they are all relatively young. It makes it really easy to work with them. I think there's just kind of a good atmosphere that we have coming to work every day. I'm sure you get that at a lot of your residency programs, but it just feels easy working with them regardless of specialty. And so I very much appreciate that about our program. And it looks like he's got the slides back up, so I will step back.
Wonderful, thank you. So yeah, you just met Dr. Smith, who is our new program director, but he's by no means new to the program itself because he's been our fellowship director for a while. And he is now filling in the shoes of the residency program director. So he is going to be the man that you're going to be talking to a lot with. Dr. Eriks is our associate program director. She is a brain injury medicine specialist. And of course, Sarah is our excellent program coordinator who will be your main point of contact. And I'll give contact information later on if you have any questions going forward. Just a brief overview about KU PM&R residency program. We are among one of the first PM&R residency programs founded in this country. We were established in 1944 along with the department itself. And some of the first residency programs for PM&R in this country are Mayo, Mass General, Cleveland Clinic, University of Minnesota, and us. It is a 3-year advanced residency program in PM&R. There are 4 residents per class. So there are a total of 12 residents dedicated to PM&R, and then we usually have up to 3 interns who are preliminary working with internal medicine team, and then they eventually move up to PM&R starting their 2nd year. Okay, and some specialties and experience we cover. You've probably seen this similar slide with other programs as well. We basically cover everything. That's really the gist of this slide, from stroke, brain injury, spinal cord, to amputees, prosthetics, orthotics, wheelchairs, and of course, electrodiagnostics, EMG, nerve conduction, peds rehab, and cancer rehab. And really the highlight, I think, of this is the musculoskeletal spine and sports medicine care. That by far, I think, is the KU program's greatest strength. You can tell Dr. Smith himself, of course, being a MSK and spine specialist. And you will hear later that we also have a NASS-accredited interventional spine fellowship program available here at KU as well, which I'm going to be attending next year. So I'm actually staying an extra year. But to really reinforce that, you'll see the procedural exposure is immense. So over the course of 3 years from PGY2 up to PGY4, we get easily over 250 cases of nerve conduction EMG. We are just sorry about this. We are just starting PGY4 year, and I'm already done with my cases requirement for graduation, that is. And then we get botulinum toxin injections using all 3 major brands that's available out there, the Botox, Dysport, Xeomin. So you get to learn the differences of each of them, the strengths and side effects of each of those, and you get to experience all 3 and then pick out which one's more appropriate for which circumstances. And of course, you do get to learn a lot about intrathecal baclofen pump management, from refills to all the good things and bad things that come with it, and how to manage emergency situations that is associated with it. And as mentioned previously, the interventional spine procedures, we get a whole range of these, and you get a lot of these exposures right from the get-go in PGY2 year. In fact, if I, remembering back to when I started as a PGY2 here, literally the very first day of my residency here at KU, I got to work with one of our spine attendings to help out with a medial branch block, actually laying my hands on the patient, actually putting the leads in and working on those processes. And then you get a lot of ultrasound guided procedures in peripheral joints, and you get a lot of practice. We get routine practice with ultrasound during didactics and outside of didactics as an optional course if you want to reinforce your skills. So you get a lot of those throughout the year. And then, of course, specialty peripheral joint injections like PRP. We also get to work with Tenex and Iovera. So that's ultrasound guided tenotomies and of course, cryoneurolysis of peripheral nerves. Tenex, just to quickly highlight, one of our attendings, Dr. Siegel, is a key figure in this particular technology. So not a lot of programs will have you exposed to Tenex this early on in your careers, but here at KU we do. And we also get to work with the master with it. Just a few images demonstrating our procedural experiences. All residents, including interns, if they are rotating with us, will get to experience all these procedural experiences right from the get-go, as much as you want and as comfortable as you are with it. And our call schedule arguably is probably one of the best in the country. It is home call. It's a 7-day long home call for the acute inpatient rehab unit. And when you're on call, you'll be in charge of a maximum of 29 patients, usually less than that. And you will see maybe 0 to 4 consults per day on a weekend. Sometimes you see none at all, so that's not routine. And you start from Friday evening going to the following Friday morning. This might sound daunting if you haven't been on call at all, as I know many of you are currently medical students. But when you go through intern year, you will quickly realize how this schedule right here, this screen, probably the most important screen in all my slides. This is potentially one of the easiest calls you will ever have in your medical careers, period. It is incredibly easy to do, and you still get to you still get exposures to all the things that can happen over call, and you get a lot of that, but you also get a lot of your weekends off throughout the year. Just to highlight that, as a PGY2, you cover a total of 7 weekends, so 7 total weeks, including those weekends, for the entire year. That is it. And as a PGY3, that number goes down to 4 weeks, and as a PGY4, you cover 2 weeks, and then an extra week earlier in the academic year just to help out with the new PGY2, but that responsibility is minimal. So this slide probably is the big one that you want to pay attention to. Just a quick summary of benefits. You do get health insurance right from day one of employment. You do get book stipends, conference stipends if you're presenting, and you do get 3 weeks a year per vacation and 10 days for sick leave, and $50 for every 2 weeks for food allowance on campus. And as a PGY4, you get funded board review courses paid by the department. And just to quickly highlight alumni achievements. So we do have 100% AB/PM&R written boards pass rate. And a lot of our residents end up going to fellowships. Some don't, but there's no harm in doing that. As you will learn in PM&R, that is not a requirement, and people do just fine without fellowships as well. And here at KU, we offer the NAS Interventional Spine Fellowship that I mentioned previously, that Dr. Smith used to be the fellowship chair, fellowship director of, and I'll be joining them next year. We also do offer ACGME Pain Fellowship in conjunction with the anesthesia department. And we have another senior resident who is applying for this right now, and he will find out soon enough where he's going to go. Our previous chief resident from last year, Vinny Francio, is a juggernaut in research, and he actually matched to this fellowship here at KU. So he's actually over across the street doing this now. We also have, that's supposed to be sports, not spots, sports medicine, peds, and cancer rehab fellowships, among others. And just to name a few places that our residents ended up going to for their fellowship. And these are just some of the ones that popped into my head that I know of from the past couple of years. And there's way more, of course, beyond this. And just a quick picture of our graduation from last year. You can see it's a relatively small class, total of 12 of us. In the middle there is Dr. He was our former program director. He is leaving us in just a month or so to become a chair at a different institution. We're grateful for everything he's done, and Dr. Smith is going to take over his role, and he's already been doing excellent. So we're all very happy with everything he's been doing for us. Just a quick show of Kansas City as a city. So you can see it's centrally located. Almost every major city in the country is within 3, maximum 4 hours flight away from Kansas City. And we also have a brand new airport that just opened. So access to anywhere throughout the nation is extremely easy. I just wanted to highlight how amazing this place is to live. And of course, life in Kansas City is also excellent. One of the best in the nation for cost of living. There's almost no traffic. Most KU sites, even the satellite ones, are maybe 15-20 minutes from where most of our residents live. It is centrally located, as you just saw in the picture. And the food scene, of course, is excellent. We are #1 in the most barbecue restaurants per capita in the country. So there's no shortage of that. And of course, Major League Sports with Kansas City Chiefs, who just won the Super Bowl, Royals, KU basketball, which is also famous. And we are going to be the host city of the 2026 Soccer World Cup. So if you match with us, then you will be here in the thick of it. So that will be also exciting as well. And finally, just some contact information on who you should reach out to if you have any questions. And thank you again for your interest in our program. And I will now open up the room for any and all questions. I would like to just kind of talk you through. I think that might be more fun.
Yeah, that sounds good, Victor. I'm seeing a couple here, so I'll just go in order of what I'm seeing. The first one was about, do we have didactics available virtually? The answer to that is yes. Dr. Smith does a weekly lecture. It's usually like 30 minutes or so. They're now on Thursday mornings. Typically, this is MSK related stuff that's geared towards our spine fellows, but anyone is welcome to join. So that's a great opportunity. If you're interested in KU or just want to see kind of how things flow, you're more than welcome to join those. And we can definitely get the link posted in the chat here in just a minute. And then another question was, have you had US IMGs as residents in the past or currently? So the answer to that is yes to both. One of our PGY3s right now was an IMG.
I am an IMG.
Yeah, so we've got plenty of them. I know Dr. Golergan himself is an IMG, so we've got that well represented in our program, and actually several of the attendings as well were IMGs. So we certainly welcome that. Let's see, what opportunities are available for residents to get directly engaged with the local community? What does sports coverage look like? I'm assuming with community engagement, you're probably looking for like either sports or maybe like some, adaptive sports kind of stuff. If I'm wrong, please let me know, but that's just based on your question. That's what I'm guessing. We do have that. So we actually just started working with an adaptive sports association here in Kansas City. They do a couple cool events every year. So they do some like wheelchair basketball. They also do like an adaptive water skiing event, which we had several residents go to this year. It's a pretty cool experience. Kind of neat to see because a lot of times we're exposed to these patients when they have, a traumatic brain injury or spinal cord injury in the rehab hospital. But this is kind of a nice chance to see them months and months down the line when they're doing a lot better and able to really get involved in the community. Sports coverage, I can certainly tackle that question. I'm going into sports this year. And so I would say we've really tried to beef that up over the last couple of years. We had not had a sports fellow in a little while. We have a couple different opportunities. We can always cover high school football games. That's pretty standard. You'll probably see that at a lot of programs. They do several different like mass participation physicals throughout the year at different high schools around the city. And then we can actually do it with the Kansas City Ballet as well. It's kind of a cool experience just because they're really high level athletes, crazy flexible. And so it's kind of neat to see some of that. You can, if you want to, go cover the sidelines for the minor league soccer team here in town. So Sporting Kansas City is kind of the main professional team that some of you have maybe heard of, but then their minor league team is also here. And we get an opportunity to cover that if you want. And then there's lots of like local races and stuff, either at the high school or collegiate level, as far as like marathons and cross country meets and stuff like that. So lots of opportunities if you're interested. Okay.
Next question I see is, do you offer rotations for visiting IMGs? I believe we do, yes, through VSLO, if I remember correctly. And I will post the email address for our program coordinator here as well in just a bit, so that way you can ask her directly about the process. And I saw another IMG question later below, so we'll answer that one too. So yeah, asking about what would you recommend IMG residents to focus on an application to improve chances. So that one's a difficult question to answer, of course, because there's so many things you can do to beef up your CV. But I think the most important thing is really to see if you can rotate at a U.S. hospital. I personally had a difficulty doing that in PM&R particularly because there weren't that many spots available. So I actually ended up not having any during my medical student years. Fortunately, things worked out well for me, but I think that would be the biggest one if you can actually rotate at a U.S. hospital under PM&R. If not, if you can always try to rotate at like a sports medicine coverage or something, and then see if you can talk to their program director, and if they have a PM&R department there, to at least spend maybe a week or maybe even half the month with the PM&R team, because it's kind of related. You could potentially make that argument. So desperate times, you gotta kind of find ways around it. So that is potentially something you could do.
I'd also like to chime in on that, if that's okay. I think if you're able to, going to the national conferences, so AAPM&R and AAP, that is a fantastic way to network,
I was fortunate enough to room with Andy at PM&R. I got to hang out with some of the KU faculty. And you can meet a lot of other program directors and residents going to those conferences and just introduce yourself and explain why you're interested in those programs.
And I think I saw another question up above about our inpatient rehab unit. So it is part of the KU Medical Center campus. The building is actually separate though. So it's actually across the street. So the building is kind of its own thing. So it is and it isn't in some ways, but it is still within the same department. And you can request consults from across the street, and surgical teams and medicine teams, they will come in and fulfill their consults at our unit. But physically, the location is across the street in a different building, and it's a dedicated building for us. So it's just us on that second floor. And it looks like Dr. Francio is also just kind of listening in. So Vinny Francio in the chat, that is our former academic chief. He is currently the ACGME Pain Medicine Fellow here at KU. So he's usually working across the street on the main campus. But yeah, he's there now. And last one, I can definitely put in my email address. I'm always happy to talk to anyone and everyone who's interested in anything we can do to help out. I personally had a hard time getting to where I am now, so I'm always happy to do whatever I can. Okay, and I think for the previous program, somebody I was kind of listening in at the end, and somebody asked about the research program. We do have a research track program available, and you do get extra funding, and we do have. I think every quarter we meet with the dedicated research team to get feedback on your projects, and they do really encourage you to come up with your own project rather than hitchhiking on other people's stuff. So usually PGY 2-year, you're trying to come up with a project on your own. PGY 3-year, you're really getting it going, and by PGY 4, hopefully you have something published and something out there. But yeah, they want you to really come up with your own, and that's what the research track is about. And I think the previous program also mentioned something about overseas programs. We have those now as well. That's relatively new. But just a few months back, our current PGY 3 was in Guatemala, performing his international medical mission, and along with our former program director, Dr. whose picture you saw in the graduation photo there. So both of them were in Guatemala for some time working on those. So we have a whole range of different things available for you.
So I know we're running out of time, guys. Thank you very much for tuning in. We have my email in the chat. I'm sure Victor will throw his in there now as well. We really appreciate you guys being here. Hope you take a good hard look at KU. And if you ever have questions, we're happy to answer them.
Just let me make sure we put our coordinator's email here as well.
Yeah, thank you guys so much for being here. Definitely got me very excited to be there in a year.
It'll be good.
All right. Thank you everyone for attending tonight. We really appreciate your time. Thank you for being respectful. We'll see you in a couple days.
Thank you.